Hey everyone, happy Thursday. Today we are going to be talking about Objective 2.03, which is patient and healthcare professional safety considerations. So we're going to start talking about what we do as healthcare workers to keep our patients safe, but also how to keep ourselves safe and what our employers are expected to do to make sure that we are safe as healthcare workers as well. Yesterday, you learned about OSHA and the rights that you have as a worker to be protected by OSHA and the type of trainings that you should be expected to have in place and all kinds of safety considerations. And so we're just going to continue building on that by talking about patient and healthcare professional safety considerations. So when we're talking about safety considerations, we have to look at how we're going to keep the patient safe, how we're going to keep our healthcare professionals safe, including ourselves, and also just environmental safety and paying attention to our surroundings. When we look at patient safety, we need to make sure that we are always performing only the procedures for which we have been trained. Sometimes it could be easy to say, oh, well, I know how to do that, so I'm just going to do it. But if you haven't been formally trained to do that and it's not a part of your job description, you should avoid doing whatever that is. You should also always make sure that you identify the patient. Even if you know that patient and you've already worked on that patient multiple times, it's always just good practice to double check that you are asking who they are, their date of birth, and then making sure that you're checking their wristband or their chart to make sure that you do have the correct patient. Explaining procedures and making sure that the patient understands is very important to making sure that you keep everyone safe and everyone in the loop. So you always need to explain what you are doing when you are performing a procedure or taking vital signs or whatever on a patient, and also just making sure that patient understands. For some people, they have never experienced anything in healthcare. Maybe they've never been in the hospital, and so they're going to be overwhelmed and confused. So the more that you can talk them through the process, the better it is for everyone. The next thing you're going to do is observe the patient for response to the treatment. So after maybe you have given them some type of medication or maybe they've had a blood transfusion, it's always really important that you closely monitor that patient and keep an eye on them to make sure that they don't have any negative responses to whatever the treatment was, that they don't have an allergic reaction or that they aren't starting to show symptoms of something else. And then lastly, making sure that the patient is safe before you leave the room. Always before you leave a patient room, if they're in their wheelchair, make sure the brakes are locked and that they're positioned somewhere that they want to be. If they're in the hospital bed, again, making sure that the brakes on the bed are locked, that they have their call button close by in case they were to need something, and making sure that you just make sure everything in the room is where it's supposed to be and there's no potential hazards. When we're looking at healthcare professional safety, the first and most important thing to remember is to walk and not run. It can be really easy in a hospital or a healthcare facility to start running when you are busy and you have a million things going on, you have lots of patients to see, or maybe there is a potential code or something where you feel like you need to run. But running is one of the things that leads to trips and falls and leads to workers' compensation claims and injuries. And so it's really important that as a healthcare professional, you do learn to walk and not run and don't let your adrenaline kick in and take over. Next, always report any injuries, accidents, or unsafe situations. So maybe you're in the hallway and you see that there is a spill on the floor and you're not sure what it is. It's not necessarily your responsibility to clean up that spill, but it is definitely your responsibility to make sure that you report it and make sure that environmental service workers get right on that and they clean it up, or at least put a wet floor sign down to let other people know there's a hazard there. If you were to get injured yourself or you were to witness someone else getting injured, it's also important that you do report that to your immediate supervisor as quickly as possible. Washing your hands frequently sounds really like common sense and something you would just do naturally, but it's really important to remember that you really need to wash your hands as often as possible, not only to keep your patients safe and you safe from bacterial infections and pathogens and things like that, but it's just really good practice. You never know what you've come in contact with in a healthcare facility, and you need to wash your hands as often as you can. And then wear safety glasses when you're in risk of an eye injury. We talked about PPE on Tuesday, and you learned how to put on your PPE, and you learned what types of situations would require different types of PPE. So just know that anytime there's a risk of splashes or spills or something that could hit you in the face or the eye, you need to be wearing your safety glasses to keep that safe. You definitely do not want to have to stand underneath an eye wash station. It is not fun, and you have to do it for a very long time, and so we all want to avoid that. As a healthcare professional, you should also always avoid horseplay. Again, this sounds like really common sense, but sometimes you just get bored or you get caught up, especially if you work like third shift, and you and your coworkers might decide you want to start playing around. But that usually leads to some kind of incident or injury, either for you or a patient, so you need to make sure you avoid that. Always follow instructions really carefully and use the correct posture and good body mechanics. We're going to be talking about body mechanics here in just a few slides, but you really need to make sure that you're using those body mechanics to help you efficiently move a patient or a heavy item and prevent yourself from injuring yourself. The definition of body mechanics is the efficient movement and balance of the body. Ergonomics deals highly with body mechanics as well. Ergonomics is the study of workplace design and equipment used by employees to help contribute to the comfort, efficiency, safety, and ease of use. Basically, ergonomics is the study of making sure that the items we're using in healthcare are going to be efficient for us, they're going to help us improve our body mechanics, and they're going to help us work in a safe and comfortable environment. For example, you may have heard of an ergonomic keyboard, which is a keyboard that's designed to help prevent your wrist from being bent all the time. You may have heard of an ergonomic chair, which is a chair that is designed to help you have better posture. So we have ergonomically designed equipment in the healthcare facility as well. Some of the personal components of ergonomics include things like making sure you're comfortable, that you have good posture, and that you are able to exercise more often to prevent stiffness and soreness, as well as, of course, making sure we're using good body mechanics. Some of the workplace design components of ergonomics, again, is still comfort, but also making sure that the placement of our furniture is best suited for the ease of work. For example, I have this bookshelf back here that is right behind my desk so that I can very easily just roll over to it and get what I need out of it. That is a placement of furniture that's ergonomically friendly for me. You also want to avoid the repetitive motions. So especially on things like assembly lines, it can be really easy to constantly be doing the same motion, and that can lead to really bad wear and tear on your joints, on your hands. And so we have ergonomically designed equipment that helps avoid that repetitive motion. And then also being aware of any hazards in the environment. So here is an image of some ergonomic examples for posture. You see an incorrect posture would be to like hunch over, or to be like bent over your paper all the time, or to be like slouched back. And so correct posture would be to just sit up straight, and you want to adjust your desk if you can to where it is at an angle, which is better for your wrist, and you want your feet to be flat on the floor. So that's just examples of how we can adjust our chairs and our desks in order to help us with our ergonomics. Here's an example of the ideal setup for a workstation. As you can see in the image, you would want the top of the monitor just at eye level or just below. You want the monitor roughly an arm's length away with minimal bend at the wrist. So any way that you can prop your wrist up or have it sitting on like a pad to help with that. You want to keep your back straight and your elbows close to the body. For example, at the desk I'm sitting at, in order to be close enough to my computer, I have to kind of bend my arms away from me, and it does eventually lead to some discomfort and pain. And so the only way to really fix that at this desk would be scoot up much closer to the table so that I'm not having to move my arms away from me. You also want to have some kind of chair that has backrest supporting the lower part of your back, and preferably something that has an adjustable swivel on it so that you can make sure your feet are flat on the floor and that your legs are bent at a decent angle. When we're talking about body mechanics, we're really talking about how we can efficiently move and balance the body. So if you were in class right now, we would actually have a body mechanics skill that we would be completing where you have to demonstrate how to pick up a really heavy object and move it. And so there's different things to keep in mind when we're moving heavy objects in order to keep our bodies safe. Some of the reasons we need to use body mechanics is because it's the best use of our muscles, and it makes lifting, pulling, and pushing things a lot easier. It also prevents unnecessary fatigue and strain, it saves energy, and it prevents injuries. The correct technique for lifting a heavy object and using body mechanics is avoid twisting the body. You want to bend at the hips and knees in order to place the object down, and you want to avoid bending for extended periods. So instead of bending forwards at the back and just picking something up with your arms, you really want to squat down next to the item and use your knees and your hips to pick it up. You can also always get help if the person or the object is too heavy for you to lift by yourself. Don't ever be afraid to ask for help for lifting patients. When I was a CNA, I was one of the smallest, youngest people in the office or at the facility that I worked at. And so sometimes I had residents that weighed like twice my weight, and there's no way I could physically pick them up. And so we kind of knew who those people were, and we would just plan ahead that this CNA was going to come help me if I helped her do blah, blah, blah. Here's another image demonstrating proper body mechanics. So here's your posture while you're standing and lifting. You don't want to, you want to use the footrest to relieve sway back. So instead of standing perfectly up straight, you kind of tend to like lean backwards a little bit. If you have a footrest, that'll help you with your posture. You don't want to bend at the back. Instead, you want to squat and bend at the knees and the hips. And then you also want to keep objects close to your body. The further you hold them away from you, the more strain it is on your arms and your elbows. Okay, sorry, I went too far. Remember, always use proper body mechanics, utilize teamwork, and utilize assistive devices such as mechanical lifts. Some facilities have mechanical lifts and some do not. The facility I worked at did not have mechanical lifts. I believe if you're in an assisted living facility, you were not supposed to have them, but in most skilled nursing facilities, they do have mechanical lifts that look like this image here. And those are really helpful because they can help you lift patients who are not able to help themselves. So like in assisted living facilities, they can usually kind of use their legs to help pull themselves up a little bit. In some skilled nursing facilities, those patients are just dead weight and they are not able to help you at all. And so you have slings attached to these big mechanical lifts that are able to easily transfer patients. We actually have a video we're going to watch real quick. Okay, so as you can see, those mechanical lifts are lifesavers when it comes to preventing injuries to your back. There are many times where we had patients in the assisted living facility I worked at that probably should have been in skilled nursing, but there just wasn't a bed available in skilled nursing. And so they were kind of dead weight and they couldn't help you a lot. And if I had had access to one of these lifts, I could have prevented myself from some injuries that occurred during my time as a CNA. So it's always important to remember those body mechanics and to be able to use devices like this to help you if you have access to them. And then there's just another image of someone using lifts and pads and things to make sure that they are moving someone in a way that's not going to hurt them. Another thing to keep in mind when it comes to lifting patients or working on patients, one of the most common things I see in healthcare facilities, which could be so easily fixed, is raising the bed up to your height. So when you go to work on a patient and their bed is down low to the ground, you're having to bend over them to do whatever you're doing. And most hospital beds are going to raise up. They just have a button you push and it raises up. And so the number one thing you can do as a healthcare worker is to raise that bed up to your height where it's more comfortable for you to work on them, because there's no point in you bending over and straining your back to work on a patient when you can just raise the bed. That is everything for patient and healthcare professional safety considerations. Talked about body mechanics and ergonomics and just things that you need to do to pay attention to how to keep yourself safe, your patients safe, and the environment around you. So go ahead and complete the rest of your tasks for today, and I will see you all tomorrow. Bye, guys.